Welcome to yet another episode of From Print to Pod. I have Dr. Krystal Sodaitis here. Did I say that right?
Yep. So like this.
Awesome.
Yep.
Awesome. I remembered it from previous times because Dr. Sodaitis has spoken at our conferences, so I remember how to say her last name. And she recently wrote the article Fidgeting, Stimming, and the Science of Movement, Why Stillness Isn't Always the Goal. We actually published it October 1st, 2025. And in it, she reminded us that understanding the difference between stimming and fidgeting and their roles in self-regulation and creativity challenges the notion that true attention only happens when we are still.
Exactly.
Awesome. So, Dr. Sodaitis, tell our audience a little bit about you before we get to the questions.
Yeah. So I'm Krystal Sodaitis. I am a pediatrician by training. I transitioned to a role in managed care. I'm now the associate medical director of a local health plan. And also, I am a coach for neurodiverse physicians. And so I focus on coaching physicians who identify as neurodiverse, who are having executive challenges or struggle with self-doubt, imposter syndrome, negative self-talk around their neurodiversity, their neurodiverse traits.
And in fact, I've had personal experience just hearing her expertise because we co-chaired a conference together on neurodiversity. So that's available in the
Yes.
conferences section, and you could still access it anytime. So feel free to look that up. Okay, question number one. How do you think medical education could evolve to better accommodate and even encourage movement-based focus strategies and training environments?
Yeah, I think that as we have gotten away from the sort of traditional lecture hall environment, that has really helped. The move to group-based learning, team-based learning, where people are encouraged to get up, walk around, maybe see things from different angles, I think that that has helped a lot. But then an understanding from um, physicians, preceptors, etc., that sometimes people do need to move around. Things like rocking, clicking a pen, twirling their hands, or twirling their hair is not an indication of boredom, but sometimes is a self-regulating behavior or even an attempt to continue to maintain focus.
I'm going to now pose a second question, and I'm going to toggle between questions for the medical and scientific minds that are following us and questions for the broader public and human storytelling. I think a
Mhm.
mix of that will be an interesting little episode of this series and podcast. So, you suggest movement as a form of self-regulation. How can workplace or schools create environments that celebrate rather than suppress this?
Yeah, so there are quite a few schools. I remember when my nephews were in elementary school, now maybe 10 years ago, there were California public school districts that were moving to standing desks. That some of the desks had what's called like a fidget bar, which was basically a bar that where kids could rock back and forth with their feet. Schools often now have different types of chairs, bungee chairs. We've seen yoga balls. And so I think that schools, especially elementary schools, are already embracing the understanding that children may need to move in order to maintain focus. I haven't heard as much in terms of, definitely not secondary education or even high school education. I think that as we move into the workplace, workplace accommodations can, I don't even know if you need an accommodation, but just knowing that no having leaders be more sensitive to the fact that maybe someone has their camera off, not because they're inattentive, but because they're bouncing on a yoga ball. And that is the way they stay engaged in the meeting.
That makes sense. And in fact, I'm going to turn this around just to show everyone, and it's kind of messy, but this is my standing desk. So I actually have even a treadmill underneath. And it's very popular for those of us that are working long hours in front of
Mhm.
a computer, whether you're in a practice or you're at home working. So, back to the questions about for the medical minds, have you observed differences in patient outcomes or engagement when healthcare providers allow for small movements or fidgeting during appointments or therapy sessions?
I haven't seen anything that's really studied that. And it would be interesting to know how much information is retained when providers allow their patients to move or use a fidget.
Now, fidgeting is often a misunderstood behavior. What's one misconception that you wish you could erase overnight?
That fidgeting is a behavior that should be suppressed. I talk in the article about the difference between fidgeting and stimming, and both behaviors are a way for a person to maintain attention, but the root cause of those behaviors is different. Stimming is a way for someone to regulate when they may be dysregulated, as opposed to fidgeting, which is a way to maintain attention. So I think that people think fidgeting means that they're bored or they're not paying attention, when actually it may be the thing that's increasing someone's attention.
Super interesting. What role do you think neurodiversity awareness should play in medical leadership and team culture?
Well, when they know that someone may require either fidgeting or stimming and understand they need stimming. So if this person is exhibiting their stimming behavior, which doesn't have to be spinning. A lot of people, we think of autistic people who stim and they spin or they flap their hands, like those are stimming behaviors. But so is twirling your hair. So is rubbing a piece of cloth between your fingers. All of these can be subtle forms of stimming. And so when a leader sees that, they should know this person may be overstimulated. Maybe this isn't the right time to give them a new task or provide some constructive feedback. The opposite, if they're fidgeting, they know, oh, I don't have to worry about this person paying attention. If anything, I talk in the article that, my favorite form of fidgeting is to crochet. I also have, when I'm on camera, I would generally only do that when I'm off camera. When I'm on camera, because I always have yarn sitting around my desk, I might grab a piece of yarn and twirl it between my fingers. It's just subtle and it keeps me engaged. But it's also, I've noticed that when I really want to pay attention, when I know in my brain, like, I can't let my mind wander here. I really need to focus. I will grab a piece of yarn and just start spinning it so that I can stay engaged.
What inspired you to personally share your neurodivergent experience, and how's it changed the way that you interact with others?
I think that, I mean, what inspired me was that I think that, part of my goal is to show that all brains are on the spectrum of normal, and that these outward behaviors should not be pathologized, and we should see them for the benefits that they're providing the person who's doing them. I don't remember the second part of the question, or did I answer it?
Yeah, you basically answered it. Yeah, and how has it changed the way that you interact with others?
I mean, I'm much more. First, I have to say for myself, because I feel more comfortable fidgeting, I am able to be much more engaged and pay attention much more in meetings where my mind would have otherwise wandered. And I also see it in other people. And now most people who I engage on an everyday basis, I don't know whether that behavior is fidgeting or stimming, but I have a lot of compassion for whatever their need is for that movement.
Now, do you see parallels between how medicine treats restlessness in patients and how it often expects stillness from our colleagues?
Yeah, I mean, I think that medicine sees movement as often as a negative. For example, the person who is in sometimes a small exam room who may be a little bit agitated, who needs to pace. Like that is their stimming behavior. that can be interpreted as aggressive. And so, as medical providers, we really need to understand what is the reason behind the behavior, and how can we help? How can we help? Somebody else might be pacing because that is how they focus. I'm listening to what you're saying. I just need to get some movement so that I can focus.
And I think that this is going to be one of the last questions. How can we, as friends, parents, colleagues, how can we respond when we see someone fidgeting or stimming in a way that fosters connection instead of being judgmental?
Yeah, I mean, I think the fidgeting, certainly, if you feel like someone is fidgeting because they're trying to pay attention, um, you can ask them about it. You can encourage it. Um, or you could just do nothing. Just sometimes lack of even saying anything is a form of support. If you know that someone is overstimulated, if you know that they have that they are autistic and you see them stimming, you could ask, do you feel overstimulated right now? Is there something is there a way that I can help you to re-regulate? Sometimes the answer will be yes, and sometimes it'll be no.
This is actually this is actually an important question to follow it up because clinicians might sometimes not be able to distinguish, right, between stimming that is adaptive versus stimming that is maybe signaling distress. So, how can they respond supportively and how can they even identify which one it is?
That can be really challenging, and sometimes even finding in your own language a way to ask, are you overstimulated right now? Is there a way that I can help you to regulate your nervous system? It also depends on the level of trust that the patient has with you, whether or not they feel comfortable sharing those things with you or not.
I'll actually end it with one last question. I keep saying it's the last, but if stillness isn't the goal and flow is, what does flow look like for you in your everyday life?
When I am in flow, I don't fidget. Most people don't because they are completely focused and generally regulated. Fidgeting and stimming are behaviors that people will use in order to maintain their focus or re-regulate.
Dr. Sodaitis, thank you so, so much for joining us on this really important episode and talking about something that isn't talked about a lot and isn't known about a lot. So, thank you for both covering this and for being somewhat of a pioneer in the field. Thank you.
Thank you for having me. Thanks.